laparoscopic approaches, we can see as much as we need to see. In addition, we can look at other structures. We can look at the appendix. We can look at the gallbladder. We can look at the bowel. We look at the bladder on the outside. We look at the rectum. So we get to evaluate more pelvic anatomy. We get to look at the ovaries. And if you're someone who are planning on retaining the ovaries, it's important to know that they're normal. If we're planning on taking the ovaries out, we can also be sure that we're going to get the ovaries. Whereas vaginal surgery, we probably can get them, but may not be able to. How do I decide which surgery, which laparoscopic? So I always say, I pick the one that I think is going to be easiest and best for you. And so I tend to like to do single site surgery. I've been doing it since 2005. I'm probably in the top 10 to 20 people on the East Coast for gynecologic laparoscopic single site surgery. I was the first one in Virginia, and in fact, in a 5-state radius, I was the first gynecologic surgeon to do single site surgery. I've done single site robotic surgery and traditional, or what I would call straight stick surgery. I tend to still like to do straight stick surgery, not because a robot is bad for this, but for me, with my experience, it's still easier and I can do more challenging or more complicated cases through that single site. In a worst case scenario, I might put a second incision in or a third small incision, but it's rare. And in really bad cases or really challenging cases, we may still default back to the traditional surgery, a cesarean type scar or even a vertical scar to do the surgery. So I say, whichever route I can do safest and most efficiently for you is the route I'll choose. But I tend to like to start with small incisions and work my way up rather than start with a big incision and say, oh, you know what, I actually could have done this through just a little tiny incision. And again, the biggest reason is for recovery. So what is the recovery like for a single site surgery? So for a single site hysterectomy, many of my patients who are highly motivated, who want to be back at work, for example, those who are self-employed or who depend on their paycheck, as long as they're not doing lifting more than 10 to 15 pounds, are back at work from a hysterectomy between day 10 and 14. Many of my patients actually feel great at day 10, 14, but aren't quite ready to go back to work. And typically, a hysterectomy has 6 weeks off from work, and they recover, but they recover with much less pain and a much faster return to normal life activities.